Here we're going to take a look at the kidney model. The kidney model has three distinct sections to it. On the left we have the frontal section of the entire kidney. In the middle we have what are the nephrons with the collecting duct structure. And then on the right we have a close-up of the glomerular capillaries surrounded by Bowman's capsule, or the entire corpuscle of the nephron. So we'll start here with the entire frontal section of the kidney, where we can make out the three distinct areas within the kidney. Around the outside, we have the cortex. Then we have the medulla, which is composed of the medullary pyramids and the renal columns in between those pyramids. The tips of the pyramids are going to be facing into what is called the renal pelvis. Now you can see in these renal pyramids there are vertical lines. These are all of the collecting ducts going down through the medullary pyramids, which you can actually see up here, our nephron structure with the nephron loop and then the collecting duct making its way down that medullary pyramid. The tips of the pyramids are going to empty the urine out into what are called minor calyces, which then open up into bigger major calyces. Those calyces compose the renal pelvis. Then we have the funnel that comes out of the kidney, which is called the ureter. That is going to convey urine down to the bladder and eventually out through the urethra. You can also see some of the major blood vessels here. The main ones going into and out of the kidney are the renal artery and the renal vein. Here in the middle section, we can see the nephron structure. These little maroon looking balls, those are the corpuscles. That would be the glomerular capillaries surrounded by Bowman's capsule. And then coming from our corpuscle, we have the proximal convoluted tubule. That's going to go down into our nephron loop, into the distal convoluted tubule, which goes into the collecting duct. Then over here on the right, we can see a close-up of the entire corpuscle. We have that afferent arteriole bringing blood flow into our glomerular capillaries. On their outer surfaces, we can see those foot processes or podocytes. And then we can see the efferent arteriole taking blood out of these capillaries. Remember, these are different capillaries from all other capillary beds where they are fed and drained by an artery, because the pressure in these capillaries is much higher than every other capillary bed. And we need an artery to drain it to withstand that extra pressure. And then here we can see the beginning of what will be the proximal convoluted tubule, or PCT, and you can see that simple cuboidal epithelium tissue here that will eventually make its way through the PCT.